Someone just came in. Dion?
Dion. Let's
Good
go.
morning. Thank you for joining us for the last COVID-19 update of 2020. I hope you all had a safe and Merry Christmas. Last week, as you recall, we had Dr. James Boyle, who offered us a very real look at the front lines of the pandemic in our community. Today, we're thrilled to have with us from Decatur Morgan Hospital, President Kelly Powers. Kelly, good to have you with us. And then, of course, Judy Smith with the Alabama Department of Public Health. Judy. Just a few updates. Today we have 8,901 confirmed cases and another 1,351 probable cases, bringing us to 10,252 total cases for Morgan County. Our 14-day percent positive rate is still increasing and is now at 54.93. And just talking with Judy just a few minutes ago, sounds like there's a lengthy lines already starting to form at some of the test sites.
Unfortunately, yes, sir.
So with that, Kelly, can we get an update from the hospital?
Yes, sir. We are at an all-time high of 96 positives. With that, we have 7 PUIs, 15 in the ICU that are positive, a total of 19 in the ICU, 14 ventilated COVID positive patients, 81 employees that are positive, and 92 that are self-quarantining. Our vents are down some, but unfortunately it's due to death. We've had a lot of deaths over the Christmas holidays, which is unfortunate.
Now, that's a lot of employees.
It is.
Yeah. How many employees does the hospital have?
About 1,700.
Okay. And then on a given shift?
On a given shift, we probably have 300 nurses or so, and that's what the main thing is. We've had a lot of nurses test positive, so we're trying to work through that. It's been very difficult over the holidays with that.
Sure. Well, thank you for the update.
You're welcome.
Thank you. Judy?
Well, Mayor, as you have said and as Kelly has said, you know, I'll be honest, I'm not sure exactly what we need to say at this point. This has been a really tough, difficult month. You know, it's a horrible pandemic, but it has been a horrific December. You know, what more can our hospital take? What more can our healthcare providers take? And where do we fit into all that? Now, I will tell you that this morning we started vaccinating. The health department did get a limited supply of vaccine. The hospital got theirs, I think, last Monday. And I happen to know that one of the pharmacies here in town also got their vaccine. And so everybody is complying with the state orders in terms of who should get the vaccine, the order of vaccine. And right now we're still looking at frontline healthcare workers. We're still looking at first responders. And I know that the health department is doing what it can to help the hospital with non-hospital personnel, because quite frankly, as Kelly has already said, the hospital is just totally overwhelmed taking care of sick folks. And we need so bad for there to be a bed for you. We need there to be a nurse for you. We need a medical team to take care of you. And we have just got to slow this down. Now, that being said, I think we've all already said that we are extremely concerned about the next 2 to 3 weeks. The general process is that everybody who got together Christmas or Christmas shopped or whatever they did, you know, probably the end of this week, the first of next week, and next week, we're going to see a huge uptake in tests. I will tell you that this morning on the way here that some of the testing centers had cars wrapped around waiting for folks to get tested. So I would also say to you that, you know, over the holidays, there was some comments on some of the news about how the numbers were down and this kind of stuff. That was a fallacy. That was not a real thing, because people didn't, a lot of people didn't test on Christmas Eve, but they certainly didn't test on Christmas Day. So if they didn't test and the labs didn't run the test, then the numbers are going to be down. Now, you know, I guess we could quit testing and then we wouldn't have numbers, but does that keep people from being sick? Does that keep people from needing to go to the hospital? Clearly, Kelly has told you how horrific the hospital numbers are. If you add the PUIs, the persons under investigation, as well as the confirmed cases, we're now over 100 at this hospital, and as a matter of fact, we're at 112. How much do we do before things explode? I will also tell you that we also yesterday reached the highest number of hospitalizations in the state since this pandemic began, and it's almost 2,600 people. The other thing we have to remember is when numbers go down, it doesn't necessarily mean that it's for the right reasons. Everybody who went home, everybody who left the hospital didn't go home the way we wanted them to. They didn't go to their earthly home. So this has been a really, really tough time for a lot of folks. With all that negativism, I do want to say we are doing the vaccines. We are moving on with the vaccines. And soon we hope that we will be giving it to all of you who want it. We hope that we will be developing herd immunity and getting to where we need to be. I'm going to tell you on a little bit lighthearted note, you know, in the medical profession, sometimes we have to come up with a little humor, a little whatever, just to keep ourselves going. And you know, music is a magic, it's a magic. While you all were listening to Christmas songs, we were listening to Merle Haggard sing, "If We Can Make It Through December." And so what we're trying to do is we're trying to make it through December, and we're trying not to drag what happened in December with us. I'm afraid, however, there are some of you out there that have been listening to Cher sing "If I Could Turn Back Time." If I could turn back time and not go to that Christmas party, if I could turn back time and not have gone to Thanksgiving or that birthday party or out shopping without my mask, or forgetting that mask just that one time that I ran in to do something. You know, prior to this, one of our other songs was the Beatles song, "Yesterday." All my troubles seem so far away, now it looks like they're here to stay. Listen, I'm sorry, folks. We just have to do this to survive. So just please, but please remember, as we are going into, it's time to make our New Year's resolutions. It's time to do what we need to do. And while we, you know, do look back some, and while we do have to, I want to remind you that somebody very important said one time, there is a reason that the windshield in the front is so much larger than the rearview mirror is in the back. We still have to look and glance in the rearview mirror to be sure that we're not being chased by a police officer, or that we're not being chased by a virus, or we're not being chased by something traumatic. But what we need to do is we need to look ahead. We really need to look ahead. We are very concerned about how things are going to be, how the hospital's going to be to the end of January. But we can stop this now. We can, when our turn comes, we can get the vaccine. But in the meantime, we can still do all the things that we know that we need to do. I gave my staff a little gift for Christmas because they have been so valuable, and I just want to share it with you today. It was a pair of socks, and on one side it says, "Individually, we are special. Together, we're spectacular." So I would say to this community, individually, we're special, but together, we're spectacular, and we have got to be that way. I will also tell you that somebody also gave me a New Year's gift, and a little necklace that I have on, and it says, "Make every day count." So my New Year's resolution for me, as well as for you, is, guys, let's make every day count. Let's make it count for us, and let's make it count for the people around us. Let's turn Morgan County back to where it needs to be a safe place where we can do the things that we want to do. And I think as a group, we do wish you a Happy New Year. Please, please, we can't turn back time, but from here forward, we can do what we need to do. Thank you, Mayor, for allowing me to be here.
Thank you, Judy. So I guess to you and Kelly, with the hospitalizations being higher now than any time before, only the sickest of those with the virus are being admitted to the hospital.
And they've stopped, you know, they've stopped a lot of, we call it elective surgery, but I'm gonna tell you, if you've got bone-on-bone knees and you can't walk, it may be elective for somebody else, but it's non-critical, non-essential hospitalizations. And again, it may be essential for you. But see, the other thing we've done is we've taken all our beds away from the hospital for our folks that need it, that need hip replacements and knee replacements and other, you know, in some cases even biopsies done. So we've got to turn this around, not just to say the staff at the hospital, but so that people that need care can get that care. Is that fair, Kelly?
That's right. We still have, patients who have heart attacks, who have other life-threatening illnesses or injuries that occur. And again, as Judy said, those beds now are mainly taken up by COVID-positive patients. Also, another thing, as people find out they're positive, there is an infusion, the monoclonal antibody infusion. And we have received, I know, another 70 or so this morning. And I encourage anybody that meets the criteria to please call your doctor and get that. We have seen a lot of success with that, keeping people out of the hospital. So please, reach out to your doctor and make sure that if you meet the criteria, you could get that if we have enough of it.
Was it 65 or some underlying health conditions
Yes,
that
sir.
would qualify for that?
Yes, anybody over 65, or if you have hypertension or other, diabetes, other kind of illnesses like that, diseases like that, you'd qualify for it. So.
And Mayor, not to steal Kelly's thunder, but, once you're in the hospital, once you're sick enough to be in the hospital, you don't qualify for that anymore. This is a mild to moderate before you get sick enough to go in the hospital. So, as Kelly said, if you qualify based on the criteria that you all have both talked about, you need to go ahead and see what you can do. And it has been a lifesaver for many people who have fallen into those high-risk groups. So, as Kelly said, I tremendously encourage you to do that.
Well, thank you
You're very welcome.
much. Do we have any questions, Emmy?
Hi, Kelly, can you hear us? Yeah, I'm here. This is Caroline. Oh, Caroline, so very sorry. Please proceed with your questions. Okay, my question is, right now, a lot of us think of this virus as affecting our senior citizens and, older people. We were made aware last week there were 8 inpatients in Huntsville Hospital that are kids. What is the Cato Morgan Hospital situation as far as pediatric patients? And for Judy Smith, what is her outlook on pediatric patients across North Alabama? What symptoms are these kids showing? What does she want parents to be aware of, particularly when it comes to kids?
We currently do not have any children as inpatients, but we do not do pediatric inpatient. They would all be at Huntsville. And I'll let Judy talk about the.
I had trouble hearing the question.
She wants to know about the spread of children. Do we know how many children in Morgan County are positive and the rate of
The
that?
state has numbers on state numbers, and it may be that one of our pediatricians in the health department does. I don't have those numbers with me. Obviously, that is a concern, and I do know that children who have been admitted have either been admitted to Children's Hospital in Birmingham or to Women's and Children's in Huntsville, and they would certainly have more accurate numbers than we would have. Every group is important, every age group is important, and everybody needs to be protected. Let me also mention that right now, neither of the vaccines that have been approved for the pediatric age group. As a matter of fact, the Pfizer vaccine is given to 16 years and older. The Moderna vaccine is given to 18 years and older. But if we could do the herd immunity while we're waiting on approval for the pediatric levels of vaccine, then we'll protect our children by not having it ourselves. So, but that's a great question. Tell them thank you for asking.
So define the herd immunity.
Herd immunity means that when there is enough people who have antibody protection, primarily by the vaccine, then generally you don't expose, other people won't be exposed. And a great example is we don't have measles going on in Morgan County right now or in Alabama because we vaccinate our children when they are young. We were vaccinated probably when we were young, but we vaccinate our children. We vaccinate them, give them a booster before they go to school. And even though there are some people that are not vaccinated, which would be a tragedy if we did have an outbreak, but some people that are not vaccinated, there are enough people who are vaccinated that it protects the rest of us. So us good guys who got our vaccinations are taking care of the whole, and that's what we need to do with this too.
Good, thank you. Other questions?
Caroline, do you have any additional questions for the group? I think she basically answered it. I know she doesn't, Mrs. Smith doesn't have numbers, but I mean, can she expand at all on just what is, does she believe
there have been some pediatric cases in Alabama, and again, they primarily have gone to children's hospitals and where they have specialists, pediatric specialists that can take care of those children. I do know that Huntsville Hospital, in their women's and children's program, where again, they have specialists, have had some children. They would have to provide those numbers. You know, I certainly am not aware of any deaths, and we don't want it to happen. So, you know, these are our precious children, but it's also our precious adults.
Thank you, Caroline.
Dion, you have?
Yes, I have. Kelly, I didn't get your numbers. Virginia, can you do?
Yes.
those for me?
We have 96 positives this morning, 7 PUIs, 14 ventilated COVID patients, 15 in the ICU that are COVID positive. Overall, we have 23 ICU patients when I left, 16 total ventilators. Our ventilated numbers are down, but unfortunately it's due to deaths there. So 81 positive employees, 92 self-quarantining.
Okay, Amy?
All right, hi guys, this is Lauren Perksen with WHNT 19. I know it was mentioned that vaccines have started to be given out, which is great. Do we have any kind of numbers on how many have been given out or how many are expected to come soon?
I can tell you from the hospital standpoint, we have vaccinated over 400. That includes physicians, frontline, probably a little over 100 physicians, and the rest are our employees, frontline staff. We are having another vaccine. We did get the Moderna, as Judy mentioned. All of those people, including myself, I was vaccinated with the Pfizer, came from Athens. They actually received Pfizer vaccine and shared it with us. But now we received our own Moderna. We're waiting on the supplies to arrive today so that we can do a vaccine clinic on Wednesday. We received 1,800 doses. Of that, half will go to the hospital, and then that's allocated out to first responders, other clinics, and physicians as well. So we will be doing that on this Wednesday, if that answers your question.
Okay. Perfect. And I know a lot of people are pretty excited to get out of 2020. We've been seeing a lot of comments about this, but as soon as the clock hits midnight, that doesn't really mean that COVID is going away. So is there any kind of message that you want to tell people thinking, like, we just need to make it to the end of the year?
No, I think we're just all trying to make it to next summer. And maybe the 21 means something better, you know, that 2020, we're moving to 21, which hopefully by next summer we'll have that herd immunity, and we'll be able to get, you know, see this through. I think the main thing that I would like to say is if you did spend Christmas with your loved ones, please do not spend New Year's. You know, these parties and things, please try to stay at home. As Judy mentioned, I'm anticipating some really bad things to come in the next week to 2 weeks from Christmas. This is our highest number, 96, and I think I've shared with y'all before, as we see the number of inpatients rise, it doesn't take too long for us to see the number of ICU patients and ventilated.
No, we're just like we did Christmas Eve.
Are there any big, like, New Year's Eve ball droppings, like, happening or canceled or maybe changed because of the pandemic?
Last year we had an event that was sponsored by Gerard Powers, a New Year's Eve event downtown that included fireworks, and it was to be an annual event that will not take place this year. We regret that, but under the circumstances, this is the right thing to do. You know what? I'm going into the first part of the second term of serving as mayor, and I frequently pray with our employees whenever they have a family member, a loss of a family member. I prayed with more employees during the month of December than I did the past 4 years. And that's a tough thing to do.
Yes, it is.
We're seeing those type of death rates. Not all were COVID related, but it's just still a lot of sadness taking place in our region.
All right, and then if you had a New Year's wish for the city of the year, what would that be?
Well, we all want to get vaccinated, We want people to take this very serious. We want people to stay out of the hospital. And let's get this, as Judy mentioned a while ago, in the rearview mirror.
Good morning, can you hear us? Yeah, I can hear you guys. Should I go ahead? Yeah, go ahead. Awesome. This is Wake 31, New York Club. I apologize if I missed this earlier. My computer lost service for a little bit. But is there any update on that patient who unfortunately had the allergic reaction to the vaccine? Are they fully recovered? Are they doing okay? What's going on with them?
Yes, the patient is doing well, and I won't say fully recovered, but yes, doing well, and we expect full recovery.
Are they discharged from the hospital?
I checked on that and I haven't heard back, so I can't tell you that. I can probably get that for you today if you want to know that. I did want to tell you a little bit about that, just because I think it hits home to some of the other things that we've said. When this employee came to get the vaccine, they were discussed their health and the health issues that they have. And I don't want to talk anything about the patient's health, but they had some underlying health conditions that they would not be able to get the vaccine. But the employee said, if I don't get the vaccine and I get COVID, I'm going to die. So I can either take the vaccine and the risk of having a reaction, or I can get COVID and die. And I'd rather risk getting the vaccine and having a reaction. And I just want to put that out for the community that's how serious this is. And this is someone that works at the hospital every day. So they see what's going on with these patients. And I do expect the employee to fully recover. And thank goodness the employee was at the hospital when this occurred. So just keep that in mind. I'm not sure what would have happened if the employee had been in an off-site area with the vaccine. So people that do want it and have underlying health conditions, please make sure you come to the hospital and get it. But the person had had an anaphylactic reaction in the past to something else. So they knew that it might happen, but they were worth taking the risk. So hopefully they will not get COVID-19.
Do you have any additional questions for us? No, that's it. Thank you. Thank you so much.
Okay. Well, please remember to social distance, wear a mask, and stay safe as we bring in 2021 at home. We experienced a lot in 2020. Let's continue to take the steps necessary to battle and overcome COVID-19 in 2021. To our healthcare workers and first responders who won't be able to spend time with their families, we salute you for everything that you do. Thank you very much. May we all choose to be kind as one of our New Year resolutions, as we heard from Dr. Boyles. That was very nice. Our next press conference will be next Monday, January the 4th at 10 o'clock. And until then, we'll see you. Thank y'all.
Thank you.